Global examples of social marketing. Social Marketing for Change SMARC project funded by USAID 1980 to 1998. The DFID also started funding social marketing programs from 1991. DFID currently uses them primarily in relation to its health and population development programs, family planning, HIV/AIDS, and other sexually transmitted infections, STIs, and communicable diseases, especially malaria. DFID-funded some programs are currently operating in over 30 countries. Other global programs of social marketing include public health campaigns to reduce the spread of AIDS, smoking, alcoholism, drug abuse, environmental campaigns to reduce deforestation, environmental pollution, and to promote conservation of natural resources, immunizations, family planning, emancipation of women, helping the poor and the disabled in the society, population control, and many. In the U.S., some social marketing campaigns include Click It or Ticket, encourage seatbelt usage. Blood donation programs influence people to donate blood. National High Blood Pressure Education Program. Florida Cares for Women program, breast cancer screening. The Truth Youth Tobacco Prevention Campaign. Social marketing campaigns around the globe include the Australia Anti-Tobacco Campaign Quit of 1988, the Canadian Campaign Against Skin Cancer, SunSmart, 1988, Mass Media and Health Practices Project, Honduras, 1978. Funded by USAID. This was the first major test of social marketing. Monoger applied to reduction in infant mortality in developing countries to address the growing epidemic of acute diarrhea dehydration in infants. National Breastfeeding Program, Brazil, 1981. Stop AIDS, Switzerland, 1987, developed by the Swiss AIDS Foundation. This is one of the longest-running and most carefully evaluated social marketing programs for AIDS prevention in the world. The Global Condom Social Marketing in the mid-1980s. The condom social marketing (CSM) emerged as an effective tool in combating the spread of HIV/AIDS, funded by UNAIDS and the World Bank. Social Marketing for AIDS Prevention, Haiti, 1989. Funded by Population Services International (PSI) for reproductive health and reduction in high-risk sexual behavior in Haiti since 1989 for HIV/ISTD prevention. Social Marketing of Bednets in Tanzania. 1997. Funded by the World Bank, Population Service International (PSI). Ifakara Health Research and Development Center IHRDC implemented social marketing of insecticide-treated nets in southeastern Africa as an effective malaria control strategy. Social marketing of bed nets all over Africa and other developing countries, funded by the World Bank and the U.S. government for malaria prevention. These and many more are examples of social marketing programs in the world, hence the importance of social marketing as a globally recognized marketing tool.